to come and present about self-care, which is a big part of what I do for my job is to work with families and patients on their self-care and hopefully partner and support them with that. I want to especially say thank you to Stephanie Herrick for just helping me and answering my questions and helping to educate me about the organization y'all are involved in. So today we're going to talk a little bit about taking care of yourself while you're taking care of others. Some of the things that I like to address in this presentation is the impact of the diagnosis of chronic health conditions, the impact, the dynamics around it, and also we will try to identify, I would try to talk about identifying some of the, how to navigate it, the techniques, and then head into talking about creating a roadmap to self-care. So I realize that everyone in this room is on your own journey, and everybody's in different places in their journey. And we know from one day to day that it may navigate in different ways. It may change for you. As we discuss self-care, I also want to keep in mind, even though we're mentioning taking care of others, self-care is important for everyone in the family. And that includes the child that has been diagnosed with a medical disorder. So we will talk about that, and that's something I work with on a daily basis in the clinic. I work with the children and their families on self-care. So let's talk a little bit about, So everyone in this room has many roles to play or identify. These are just a few. You may be here as a sibling, whether you're here as a sibling as a minor child, or you're a sibling as an adult sibling. These different roles we play in our life, all these impact and are involved in our self-care. And of course, let's not forget that really important role, being a parent. So all these connect with each other, and some of you can come up with a lot of other different roles you're also involved in. So let's talk a little bit about the impact of the diagnosis. So when you are working through that journey, or maybe discovering what is that about for you and your family and your child, you're going to look at how it impacts in 4 particular areas. We're going to look at the routines, the flexibility, resources, and relationship. For example, the routines, and we talked a little bit about this with the siblings when we had the siblings discussion, how routines have to get changed and adapt, but also it's important that kids have routines. And also, I'm going to have to say, it's important for parents and adults too. So those routines get disrupted. You may have done even simple as sleep schedules. So the cycles for symptoms can disrupt your routine. So part of that, which is an important element, is the flexibility. You've got to sort of shift roles. Parents may decide to do different shifts at work, adapt their schedules, work from home more, have to take family medical leave. You have to start making some shifting and discovering how you're going to be able to flex your lifestyle based on the needs of your child. The other resources that are going to impact that is, of course, your time, your money, your emotions, and your energy. I know in the hospital, inpatient and outpatient, constantly talking to parents about what they're doing to take care of themselves, but also so many of the parents I meet do not get enough sleep. and they're still trying to manage a lot in their lives. So also with the diagnosis, it changed the relationship. Sometimes it changes your connections to others. You create new connections to others. They're there to support you and help you. Also communication. How do you communicate with your partner, with your spouse, with your extended family? How do you explain to your extended family what's going on with your child? All those are the impacts of the diagnosis. So the family dynamics. So part of that is creating these wheels, but looking at illness is that wheel's a little bit bigger, because once that diagnosis comes, or you're trying to figure out what is going on with your child or your children, then that becomes a pretty big wheel in your life. A lot of things rotate around it. Your resources, how do you adapt, again, and relationships. You suddenly may become more acquainted with your primary care physician. You find out who is available in your community in the medical setting, who's going to care for your child. So all that rotates and works together and impacts each other. So, impacts of dealing with a chronic condition. So everyone has so many different emotions, and those can go in cycles too. Again, these are all these feelings and emotions I've seen. Is the difficult emotions. When I said difficult, often those are the confusion, the anger, frustration, sometimes frustration of not knowing, not getting the right answers, or getting answers in the right time, or having to explain over and over to others what's going on. The grief, you feel isolated. Sometimes you feel like that others don't really understand what's happening and what's going on with you. Children feel isolated too, about exactly what is happening, why suddenly my brother, my sister have to go to the hospital, why she or he is sick. So all this puts a drain on your resources. All these emotions, how you're feeling, and it may lead up to limited self-care. So today when we did this presentation, I had met a parent right before we started, Becky, and I'm just saying it was interesting that self-care presentation today was towards the end of this conference, right? Because sometimes self-care gets at the bottom. We're so busy doing all the other important things, and we're playing all those roles in our family that you forget that, oh, what about my self-care? I mean, you might be right on it to try to figure out what your child's self-care needs to be. But it creates, it all starts to funnel down. It may create some limited self-care. You start feeling fatigued. You start feeling stressed. And you start feeling concerned. You know, a lot of parents come in and they'll say, Pam, I'm concerned about this. This is what's going on with me. Children let me know what is stressing them out. They get concerned. It can be the sibling. It can be the child that has the diagnosis. So what is self-care anyway? So I know this is not the first time you've heard that, right? Is there anybody out there that actually has a written self-care plan they use, or is this something that you have in your head? Does anybody have anything formal they ever created? No? Okay, so let's talk a little bit about self-care, because often what I hear from parents and caregivers in general, whether it be the grandparents, the aunties, adult siblings that are helping, is I always hear about what they think self-care is, and often they think that they're being selfish or they're neglecting someone else if they're taking care of themselves. They're they're not taking care of their responsibilities. You don't understand. I have to take care of all these things. So let's talk a bit about what it is. Self-care is understanding your own needs. So as I go further in this presentation, we're going to actually look at how do you assess your needs. Also, build on your own strengths. One of the parents, I hope she doesn't mind me mentioning, but their strength was building on technology, using a schedule to allow others to help them care for their children. Equipping yourself for your journey. What do you need? Often, sometimes they'll refer to it, what's in your tool bag? Asking for help. So before this presentation got started, I had to ask help for technology. I had asked for some help to hope that the YouTube video was going to play today. So that was an example of just a simple thing that we have to ask for help. So part of your self-care, reason why I am approaching this topic of assembling a team. First, we're going to talk about the multidisciplinary or your medical team, but also that is part of your self-care. Sometimes you may not be aware of, or you've not been informed of, or may not be recognized that there may be other multidisciplinary professionals in the medical setting that can help you. These are just some of the few. There's many others. Another parent mentioned child life specialists. You have interpreters. You have social workers, psychologists, education advocates. I don't know if you're aware of most healthcare systems, medical hospital settings have what they call either teachers or education advocates. The setting I'm in, we have them in inpatient and outpatient, and we utilize those. We have a nutritionist, and then all your medical specialists, and of course nursing, which how could we do our jobs without the nurses in those settings? And also I want to mention school nurses, which also play an important part. So as you have your medical team support, they can provide many areas of support for you. And this was mentioned yesterday, advocating. They can advocate for you, they can make referrals, they can intervene, they can help with scheduling, they can coordinate, care coordination, or all the people that's part of your medical team can help do those. Case management and supportive counseling. All those are part of you taking care of yourself and asking for help, but also allowing and asking for, and sometimes families have to demand for, getting this kind of support from their medical teams. So identifying other support. I think some of you are here because you have more than one family member here today. You may have grandparents here, you may have adult siblings, everybody here. So part of identifying your other support is family and friends. And we know that friends can be family. Your social groups. What social groups do you have in your life that help support you? It also can be faith-based resources. We have state and federal. All those were mentioned. An important resource that was identified today is God Transition. That's a resource I have used for many years with many families and adapted it based on the patient's needs. Community-based resources. What is in your community? And often you don't know until something happens with your child. You have no idea. You don't even know what, a lot of times families say, I don't even know what kind of insurance plan I have. But then you suddenly become experts. You become an expert in insurance, you become an expert in school. You have to play so many different roles to try to support and advocate for your child. So part of that is recognizing organizations and foundations, such as why you're here today. This is a great support. You may need to use counseling available maybe inside your healthcare system or outside your healthcare system. And then financial services. Some of you may not, healthcare systems have financial counselors. They have insurance verifiers. Sometimes can help and assist you. You may have to go outside the system as well. That they mentioned special trust and a special trust fund. So there's a lot of ways to get support. So part of that, getting that support, leads to your self-care. It can come in many different ways. And what I say to families when I'm working with them is that some of these resources you may use more than others, but also it depends on what's going on in your life, your family life, and your child's medical needs. So they may come and go, and some of you may be eligible for some, and some of you are not, and that may be frustrating at times, knowing you need something, but there's limitations put on those resources. I also want to say legal. I didn't add that, but definitely get support legal. I know one of the resources we have that we use a lot is Health Law Partnership, and that helps provide free legal support and guidance to families, for a lot of our families. I'm just show you a commercial.
Yo, dude, you need some help?
Don't worry about me.
Yo, there's no shame.
You don't know my family, man. My parents and brothers, sisters, and cousins ever found out?
Dude, this weight is pretty heavy.
I just need some time and I'll figure it out myself, okay?
Sometimes you just need some help. So if you need therapy, find a licensed therapist at BetterHelp.com.
Okay, first of all, I'm not a part of that. I'm not a provider for Better. I just wanted to show that commercial. Has anyone seen that commercial? And you notice the gentleman starts talking about his family members, but that he's, no, I've got this. Ever been in that situation before? People say, I want to help you, and you say, no, I got this. So let's get into the important part of hopefully the meat of this presentation is talking about how do you develop your self-care plan. First of all, there has to be some planning involved, and part of that planning will be you can't plan until you do what we often call clinically is you are assessing what are your needs. So we're going to get into that, and then we're going to talk about we're going to talk about implementing and maintaining. So this is just one model. This model is looking at 8 aspects of your needs, and looking at each one of these can rate your wellness in these areas. For example, intellectual. Intellectual might be, for some families, when I'm talking to them, they want things in writing, they want websites, they want to be able to read. But looking at how's those needs getting met. On this, you could actually chart it. So it's low, high, low, high, low, high. So if you had this on a piece of paper, you could actually graph it, determine where your highs are, where your lows are, where you start in the middle. So, for example, emotional. How are you getting your emotional needs met? Are you able to express your feelings to someone you trust? Are you able to talk about what it's like for you? Physical. How well are you taking care of yourself? Are you walking? Are you running? Exercise? When was the last time you had a physical? When's the last time you had any vision care? So part of that is physically. How well are you taking care of your physical needs? Then we go into social needs. Do you ever, Interact with friends. Do something social. Do something for fun. Go to the movies with your husband or wife. Go to the park. Being playful. Vocational, so for all of you that are working, either self-employed or employed full-time at home as a caregiver, or you're working on a job, how are you taking care of yourself on the job? What are your needs? How are you getting your needs? Are you setting some healthy limits with your employer, co-workers, taking breaks, actually take your lunch break? Environment. So your environment might be your work environment, you might be in school, it might be your school environment, and of course your home environment. Where are you with your needs there? Asking for help, even having someone come in and help with what needs to get done in the house. And then your psychological, being able to adapt. Maybe feeling depressed or anxious. How are you addressing those needs? Spiritual, feeling connected, your own values and beliefs. Also, religious practices, how are those needs getting met? And how do you put that into a care plan? So we take all those elements, or needs, I would say, and take them in so you can build your own self-care plan. We know there's many apps out there that talk about self-care. You can use apps, you can use paper, you can use your phone, you can use different devices, programs on the computer. But part of this is talking about how do you build your self-care. So all those different needs I just talked about, the spiritual, the emotional, what would you put in those? And I would start, I will take a lunch break. I will walk. I will go outside. They need to be words of action. So again, what is your action plan? And this is what I say to a lot of times adolescents, because they're coming into the clinic, and I'm primarily in a clinic for endocrinology, and for diabetes care. A lot of the teenagers, they know exactly what their care plan is. They know what they're supposed to do, what they don't need to do, et cetera, et cetera. And so part of that is my role I play with them is to support them in their plan of care. But also I talk to them, what is your action plan? So if they're saying, I'm struggling in this, they assess what is that about for you, but then what is your action? What are you going to do about it? And who can you get to help you with it? What resources are you going to use? So I actually work from infant through 21, 22 usually. So those are different needs for different people at different times, right? So part of that, you want to personalize it for you. Stephanie brought up a very good point in one of her emails, because she emailed me back and said, what about a self-care plan in case of emergency? And then I think in our sibling discussion, COVID came up. So I was actually inpatient, working in liver transplant and primarily transplant services at the time of COVID when we first really shut down. Part of that, suddenly we all had to come up with emergency plans. We all had to adapt and change things in our lives, but patients and families, those that did have self-care plans or had fairly effective coping skills they were using, suddenly this emergency had happened nationally, and it was affecting all of us. What do you do in case of emergency? So what I would suggest is you come up with a self-care plan, but also come up with an emergency plan. What do you do in case of emergency? What do you pull in to help you? How do you get the tools in place to help you? But I will say, and I say this to parents, is that whatever you do to take care of yourself, you're helping your child. So it works together. So each family member caring for each other, of course, loving and supporting each other, but also having your own self-care plan. So if you're practicing that and you're more equipped and feel more refreshed and able, when an emergency happens, and it will happen, a crisis will happen, a medical crisis do happen, then you'll be better equipped to put that in place. You won't feel so fatigued or stressed out, and you'll have some tools you've been practicing. But it's okay that when an emergency happens, you may start feeling that again. This past week, I was talking to a parent, and their teenager had come into the clinic. The physicians came into me and said, "Pam, I need you to come into one of the consult rooms. One of the parents is very upset." So part of that is, and of course, being a teenager, the physician continued to talk with the patient. And the parent was, even though she had a care plan in place, there was her son had just recently been in the hospital, had a crisis, medical crisis. A number of things had happened, and this was their first visit into the clinic. And so she just said, "I feel exhausted." So she started talking about all these concerns she had, feeling pretty emotional, and then also stating, "I feel invisible. I feel invisible as a parent." That was a pretty strong statement to hear. And she also made a statement to me, "I know it's your job to be here for me. I just need to know that people still care about me." So we met for a significant amount of time, and we also discussed what was going on, how for her to get support, and also to sort of recharge and restart her self-care plan and come up with it. And then talked about, again, sort of about what happened and what could be different for her, and figuring out what needed to be done now to meet her needs. So sometimes a crisis can set you off. You've been doing all these great things, or something happens, something falls through, you get another diagnosis, and that really sort of regresses back to all those feelings that she felt before. So part of that is just trying to find others to help you, and then she was able to identify. And as she left, she said, I feel better now, because I feel like you all listened to me." So it wasn't just me listening to her and trying to help her. It was the physician too. It was the other people on the medical team that was there for her child and her that day. But also realizing, oh yes, and when she left, she said, "I know I've got this now because I know what to do. I know how to utilize the resources that somehow fell aside for a while, that she used to use but hadn't used in a while." So we talked a little bit about prevention and how to take care of herself. Oh. Okay, it's stuck. There it goes. Okay. So most of the time, families ask me, "Well, where do I start?" So that's a great question. Where do you start? If you haven't made a plan for yourself, where do you start? Start where you are. Okay? So part of that, going back to that one model of assessing your needs, start with that. That's your groundwork. That's your basis to branch on in now. We're implementing your plan. You've assessed it. You've determined some of your highs was in the emotional area, let's say emotional and social area. So some of your goals or your how you're going to put on that. For example, that one family member she had a very supportive family member, but she hadn't called on her to ask her for help or support lately. And her plan was to call that person and get some respite care from that person that knew how to help her, who was effective and trained caregiver for her child, but she hadn't used her in a while. So part of that is looking at, start where you are, focus on the small wins. Okay? Think about, give yourself credit. Start with your strengths and build on those. That's one of the foundations in social work. We base our practice of social work is based on strength building of families. Celebrate your wins. So when you're able to do some things on your self-care plan, maybe you won't do everything on there, but you've done some of them. Some of your goals, and you say, hey, I did this today. I've accomplished this. Be kind to yourself. Be respectful to yourself. Be grateful and adapt as necessary. So plans, one thing about an action plan, and this is what I tell kids, action plans are meant to be changed. So even working with kids in school, and people often think, well, individual education plans, IEPs, we all know for a lot of children with medical conditions and problems have 504s. But you may have an individual education plan. And a lot of parents say, oh, well, I can't change it. We just renewed it this year. I said, no. You can change it. It's adaptable. You can add new goals. You've accomplished goals. You can change goals. Do you have a question? No. Okay. So thinking about it as a working document that can be adapted and changed as needed based on your needs. You're working on your self-care plan first. Sometimes it's easier to work on someone else's self-care plan, but this is the one for you. Everybody needs an individual plan. And then the third part of your plan is maintaining your plan. How do you maintain it? Well, again, you review and you reassess. And I think an essential part is that you have to be accountable. So when you have a self-care plan, you need someone that you can be accountable for. So if you have a partner, if you're working as a mother-daughter team, or you're working as siblings, or you're working as your best friend and you, then have someone you can check in and ask for feedback. They may have some good points to give you that can help you along the way. But it's really important to put it on your schedule. We all have these wonderful parts of our life, and a lot of the kids and all the adolescents always have their phones, right? They're part of it. So part of that is using your technology you have available to put you on a schedule or remind you. To help you do alarms or daily reminders. You may want to put your self-care plan on your phone. You can do that. And then revise it as needed. So I guess my important point I'm trying to make here too is that self-care plans are not something that has to be done one way. There's various ways to do it, but the most important part of it is have one. Have a plan. And you probably have been operating in some kind of self-care plan. You just may have not formalized it, or maybe didn't even identify it as such. So here's a little simple self-care recipe. So you can take a sprinkle of kindness, a sprig or two of support, a spoonful of creativity, and you could be as creative as you want in the self-care plan. You could create a new, own, unique plan of how you could make it. You could use art, you could utilize music, any kind of creativity you want to put into it. You could use humor in it, which is one of my coping skills. An ounce of fresh air. And then we don't want to forget the self-love. And then you're going to mix it all together and hopefully consume it often. Okay? So notice some of those things are all positive elements that you want to put in your self-care. It's be kind to yourself. Let people love you. Love yourself too. And don't get in that trap of thinking you have to be the perfect parent. You have to know all the answers. You have to do it all yourself. So, any questions? I hope I'm staying on time.
We're good.
Yeah.
Anyone have questions for Maria? Well, she'll be part of the panel too.
Yes, I'll be in the panel. Anybody have any questions about how to set up a self-care plan for you, for your loved one, or you?
Is it working? It's not working. It's not working.
Hello? Can you hear me? Hello? Okay. I just wanted to point out, I really liked what you said about being specific about when you work with your self-care plan, just because I think sometimes in my mind it can be a bit general, and I think back when Christopher was in the hospital when he was really young, and it was a friend that came to me and was like, look, she evaluated the hospital stay or whatever, and she sat me down later and she said, the next time, you need to leave the room, or take a shower. And these sound like simple things, but it was helpful to me in the moment to have something specific to work toward, because those things are super important, like you said, because the next time I think I took a shower, I don't think I left the room, but we work toward getting out of the room, right? So
Yes.
But you do feel like a different human being, and it helps you communicate better with the doctors. When you've done simple things for yourself, but it's super hard when your kiddos are sick. So I appreciate the fact that you're able to just encourage us to be specific with what those needs are.
Yeah, they can be as concrete as taking a shower and stepping out of the room when you're in the hospital. I mean, oh, I'm sorry. I forgot. I apologize. It can be just as concrete as taking a shower, spending time, just stepping out of the room, and ask anyone on your medical team on your floor, the nurse. If you've not met a social worker, you have a right to ask for anyone that's part of the hospital staff to support your child and your family. When you have people assigned on your team, they may not necessarily come, but you may request it. The medical team can request it, or that person may initiate coming just to come in and check in and encourage you. A lot of time it is self-care. A lot of time the nurses will say, please leave the room. We've got this. We promise we'll watch your child. We'll take care of them while you're gone. Sometimes it's easier to do self-care if there is people around you that support and encourage it. And it is more challenging when you don't feel like you get that support. I know being in the medical profession that we can do a better job of that, and I hope that we will continue to work on that. And that was brought up attention to even talk about transition of care to adulthood. Who talks to you? Who's available to help and support you through that process?